All right. Hi, everyone. I'm going to go ahead and get started. We're right at 12:30. I want to make sure we have time to cover everything today. Welcome to our Missouri Open Door Benefit Series. Today's topic is choosing between Original Medicare, Medigap, and Medicare Advantage. I am going to go ahead and send out a welcome poll as we start. If you could go ahead and fill that out, that would be great. Okay, so my name is Angelina Alpert. I am a research assistant at the University of Missouri, Kansas City Institute for Human Development. And these new benefit series mods are sponsored by Medicare Improvements for Patients and Providers Act, or MIPA, priorities 1, 2, and 3. So we have CLAIM, which is the State Health Insurance Assistance Program, the Missouri Department of Health and Senior Services, and UMKC Institute for Human Development, which is the No Wrong Door designee for the state of Missouri. So just a little bit about Missouri No Wrong Door. The goal is to transform the way people access services in the community. So the goal is to support individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and supports, regardless of age, income, or disability. So with these open door workshops, our goal is to open doors to integrated supports. So if you're familiar with the Charting the Life course, this is the integrated support star. So our goal is to focus on all 5 types of services and supports to ensure that a person is getting all of the services and supports that they need and are integrated into their community. So we have personal strengths and assets, so skills, anything that a person is good at, relationships, whether it's family, friends, or acquaintances, eligibility specific services, which are need-based government paid services that somebody has to meet eligibility criteria for, which that is what this Open Door series is about. Up until October, we're going to be focusing on Medicare, and then we will open it up to other eligibility specific programs. Then we also have community-based supports, which are places in the community, groups and memberships, things that anybody in the community would have access to. And then lastly, we have technology, which is our other open door series. And that focuses on anything from personal technology, so your phones and your laptops, all the way to assistive or adaptive and environmental technology. So the benefit series, the one that you're at today, we have our next one coming up July 12th, which will be Pay Less for Medicare Options. And then the technology series is coming up in 2 weeks. Sonia, if you want to go ahead to the next slide. Coming up in 2 weeks on June 28th, and we'll be talking about assistive technology for health and wellness. Next slide. And then I'm going to go ahead and pass it over to Claim, who's going to take over for today.
All right. Thank you, Angelina. My name's Gary Gummig, and I'm on the strategic outreach team at Claim. And Sonia Baskarin is on the call as well. She's a newly minted Region 3 regional liaison with Claim, and she's going to be driving and helping me with this presentation today. So thanks for joining us. And really the topics for today, and we're going to go through quite a bit of material today. Some of it will be a little bit of a review from our last series just to kind of set the table for Medicare. But really we're focusing on different parts of Medicare: Original, Medigap, and Medicare Advantage. And really what we're trying to focus on today is provide an understanding of what you pay for your healthcare services is directly impacted by your choice of Medicare options. So these options that we're talking about, the Medigap and Advantage, Original Medicare, all impact how much you'll pay for services. So we're going to go through that, go through some examples as well. So we hope this will be good. So just from a logistical standpoint, we're going to use the chat feature on your screen so you can ask questions during the presentation. We'll try to take some as we go, but mainly we're going to kind of try to get through the material and then go through the questions probably closer to the end. If you've got a burning question and want to raise your hand, that's okay. We'll try to get to you there. Please don't use any personally identifiable information in your questions. Those we can direct you to the claim call center or the contact center, and they can put you in touch with a counselor that can help with that question. So, and as always, if you need material for Medicare, palm cards, or other materials, again, you can call the claim call center at 1-800-390-3330. So with that, just kind of who is claim? As Angelina said, we're the State Health Insurance Assistance Program, or the Missouri SHIP. So every state has an assistance program or a SHIP program, and claim is Missouri's SHIP program. It was created by Congress as part of Medigap reform. And a lot of what we do is Medicare education, just like we're doing today, trying to provide Missourians, beneficiaries, information about their Medicare choices, answer their questions, and we also give feedback to CMS. So one of the main things that we want to make sure everybody knows is claim counselors, we don't sell, we don't promote any insurance company, any of its products. We can't be an agent or a broker for a couple of years back anyway. So we don't have a dog in that fight. Really, we're there to provide unbiased information to Missouri beneficiaries, and that's what we do. So a lot of what we do, enrollment and billing help. We answer questions around Medigap or supplemental insurance, kind of one and the same program there, just two different ways to call it. Advantage plans is a lot of what we do. Open enrollment is really one of the kind of our Super Bowl, if you will, at claim. So October 15th through December 7th, we are heads down, all hands on deck, getting people enrolled in Medicare, Advantage plans, drug plans, and answering questions. So that's, like I say, kind of our Super Bowl, but we do a lot of different outreach events as well as just one-on-one counseling. So just to start out, what Medicare is, it clearly is a health insurance program for people really over 65 and older. If you've been on disability for over 24 months, that's another way to get into Medicare other than aging in. And Medicare is administered by CMS, yet you enroll through Social Security Administration or the Railroad Retirement Board, which is kind of confusing, I know, when you think about it. But if you're working with a beneficiary and they don't know where their card is at, they'll say, what we'll say is, hey, do you have a red, white, and blue Medicare card? And that typically jogs their memory. And then they say, oh yeah, here it is. So then we kind of begin the process. So this diagram really shows kind of two paths to get your Medicare benefits. So at its simplest, you can either choose original Medicare, and some people call it traditional Medicare, but it's the same thing. So we're gonna use the term original Medicare for purposes of this seminar. And Medicare Advantage program, or Part C. Again, two different names, same thing. We're going to use Medicare Advantage for purposes of this. And as you can kind of go down each side, you can see the different parts, but we're going to focus on three. So if Sonia will advance, we'll show you that we're going to focus on the original Medicare Advantage and the supplemental coverage, which you'll hear that called Medicare Supplement or Medigap. Again, same thing, two different names. So don't let it confuse you. And the Medigap can only be used with original Medicare. So that's kind of one thing to remember as we go through this. So just to start out on the parts of Medicare, again, Part A is really, think of it as your hospitalization insurance. So your inpatient, medical, psychiatric, skilled nursing, home health, hospice. And the nice thing about Part A is it is typically premium free if you've worked and paid into Medicare for at least 40 quarters, which you or your spouse have paid in 40 quarters or more. And the way it works is Medicare pays 80% and you pay 20%. That's your coinsurance after your deductibles are met. And there are deductibles for Part A of like hospitalization, $1,600 if you check in as an inpatient to the hospital. So there are expenses associated with Part A with original Medicare. So Part B, let's go to Part B. Think of that as your doctors. So doctor services, outpatients, your labs, diagnostics, therapy, wheelchairs, things like that, durable medical equipment. All those are typically covered under Part B. And Part B premium is $164.50 this year. So that's every month, whether you have original Medicare or a Medicare Advantage, you have to have the Parts A and B, and the premiums for both are the same within that structure. So, so far, so good. There's not a lot of differences at this point. So if you have an Advantage program, you're still going to pay your $164.90. So what are the benefits of original Medicare? So certainly probably one of the primary benefits is your nationwide coverage. There is no network for traditional Medicare or original Medicare. So any provider, any hospital, doctor that takes Medicare is your network. So it doesn't matter across what state lines you're going. If that provider takes Medicare and you are on original Medicare, that's within your network. So nationwide coverage. The benefits are standard. You've got options to add coverage, like the Medigap works hand in glove with original Medicare, and Part D, which is your drug coverage, that also works hand in glove with original Medicare. So you've got options to kind of build up your coverage and cover more of your potential costs. The limitations, there isn't built-in drug coverage. You have to buy that. There's a premium associated with that through private insurers that are certified through Medicare. And those premiums range anywhere from, say, $7 a month to over $100 a month, depending on what drug plan you might choose. The other thing is limited non-medical coverage. And what I mean by that is it doesn't include dental, it doesn't include vision, it doesn't include hearing aids, things like that, where you hear the Advantage programs do include that. That's true. And traditional Medicare does not include that. So you have to factor that into your budget as you're looking at your options. Premiums and deductibles, you've got optional benefits like the Medigap, but the Medigap comes with the premium, which we'll talk about, as well as deductibles. And kind of the big limitation that I want to make sure everybody understands with original Medicare is there's no maximum out of pocket for the beneficiary. And so we talked about Medicare paying 80% and you being responsible for 20% of the costs. If you're in the hospital and have hundreds of thousands of dollars worth of medical bills, that 20% gets to be a big number. So we encourage people to think about that as they look at their coverage with original Medicare and consider ways to reduce your exposure. And that's what we're going to talk about, how to do that. So just to give you an example, we've got Clara who went in for a 4-night stay at the hospital after a heart attack, and her bill was $500,000. So it was a serious event, and she has original Medicare. She doesn't have a Medigap, so she just has that Part A and Part B that we talked about. So what are going to be her costs that she incurs and is responsible for? So the hospital deductible when she checks in is going to be $1,600 this year. And that changes from year to year, but this year it's $1,600. So that's the Part A part, if you think about the hospital. Part B has an annual deductible of $226 for original Medicare. So she taxed that on, and then the patient coinsurance, 20%, is $100,000. So, total out of pocket for this patient, for Clara, with original Medicare is $101,826. And you have to swallow pretty hard for that one. That's a lot of money to be responsible for. So we want to figure out how we can reduce the beneficiary's exposure with original Medicare. We like the ability to have, to be able to go to any person we want to, any doctor or hospital. We like that kind of thing, but we don't like $101,000 out of our pocket. So that's where Medigap comes in. And it's designed to work with Parts A and B, and it covers those out-of-pocket expenses like your deductible, like that $1,600 we talked about, the $226 deductible, all sorts of deductibles, the co-pays, the co-insurance. So if Medicare Parts A and B cover an expense, as in it's an allowable expense, then the Medigap will automatically cover that expense as well. If it's not covered by Medicare in the beginning, say it's a cosmetic procedure or something like that, that's not covered by original Medicare, then the Medigap's not going to help either. So it's got to be approved by Medicare, a Medicare expense, and Medigap is kind of that secondary insurance that provides that safety net for you that we talked about. So again, the Medigap doesn't matter what state it's in, it's nationwide. So if you were a snowbird and went to Texas, that's okay. The Medigap's going to provide that secondary insurance that's going to pay those expenses. And there are a lot of different kinds of Medigap plans in Missouri. There's 12 plans available, and they are standardized by letter names. And again, those are sold just like the drug plans. They're sold by private insurance companies. They have their associated premiums with them. And so based upon what kind of coverage you're looking for, you look at the plans and kind of figure out how much coverage that you want. To be eligible for Medigap, you have to be enrolled in Part A and B. And the important thing to remember about Medigap is the time to get it is right when you enroll for Part B, because it is a one-time opportunity, typically, and you have 6 months to get your Medigap in place if you don't want to have any medical underwriting. And so that's a very important part. So that means the companies you're guaranteed approved for a Medigap policy if you do it within this open enrollment period, this 6-month period from Part B. So they can't charge you more than any other person, regardless of your health condition or medical condition. It's all the same price. It's automatically renewable as long as you pay your premium, which is important as well. So if you have if you've had cancer or like Clara had a heart condition, and you want to get a Medigap, the time to get it is in that 6 months where they can't do any underwriting on you. You can get a Medigap after that 6 months, but you're subject to medical underwriting, so they can charge you more based upon your health condition. They could deny you because of your health condition. So that's why it's important to kind of strike while the iron's hot there in your open enrollment period. If someone was on disability, which we talked about for 24 months, that gets you into Medicare, you can get a Medigap at that time. So before you're 65, you could have a Medigap as well. And then when you reach 65, you age in, and you've got a second opportunity actually to enroll in a different Medigap if you'd want. And we talked about the guaranteed issue rights associated with the open enrollment period. So that's the important part. Okay, in Missouri, and every state has a little different regulation with Medigap, but Missouri is a very beneficiary-friendly state when it comes to Medigap. And the Medigap policies are issue age rated, so it means that everybody's getting charged a rate at whatever age you come into the program, into the Medigap program. And so that sounds really good, but I do want to caution everybody that the premiums do go up with inflation. So sometimes they go up every year, depending on the carrier. Sometimes they will go, increase every 2 years, but they increase more. So every carrier has kind of their own methodology for their increases for inflation. So something to keep in mind as you buy a Medigap policy is they may start out at, I say they start out, say, $150, $160 a month at 65 if you get it within your guaranteed period. And that's just an average. They vary widely. When you're 80, that policy may be $300 a month instead of $150 a month because of the inflation adjustments. So keep that in mind as you look for your plan. So just to make sure it fits into your budget. And the nice thing about Missouri is one of like 5 states that offer this annual guaranteed issue right to shop Medigap plans. So let's say that you purchased a plan G, which is kind of the Cadillac of plans for Medigap in Missouri. Your anniversary period for your Medigap, 30 days before and up to 30 days after, you've got the ability to go out and look at all the other companies writing in Missouri and shop for a better price for that G plan. And you're still within the guaranteed issue. You still have that protection. They can't charge you anymore, but you can shop the price. So say you got into a company and they raise their prices way more each year than you think they should. You can go out and shop and see if there's a better deal. You just have to stay within your plan, just to keep out of the underwriting. So, like I said, the shopping tips on this, on a Medigap, it's designed to pay the gap. That's why it's called Medigap. So those at $1,600 hospitalization deductible, the 20% coinsurance, that sort of thing, that's what it's designed to do. And it's very nice for the beneficiary because if you went in the hospital and they know you have a Medigap policy, they automatically bill that Medigap company before you even see a bill. So typically you don't have much of a bill for that. And again, it pays to educate yourself on the types of benefits because each one of them pays a little differently. One may pay 75% of the out-of-pocket costs. One may pay 50%. One may pay 100%. Again, the premium adjust based upon what they pay. So, okay, Sonia. So a great resource for you is the Medigap Shopper's Guide, and it's put out by the Missouri Department of Insurance. And you see the plans that are out there down below. I'm not going to go into all of those, but Sonia's got a link there that she's going to click on that goes out to the Missouri Insurance Department. And they've got a great resource here. As you scroll up a little bit, thank you. You've got the Medigap Rate Shoppers tool, which we're going to go into. You've got the Missouri Medigap Shopping Guide down there as well, and a Consumer Complaint Index. So we'll talk about this shoppers tool here in just right now, I guess. So we're going to go down and we're just going to show you kind of what it does here. And this is something that you can do at home as well. So go ahead and we'll put in our age down there at 65. So if you click that, Sonia, and go up to the drop down 65. So we're assuming we're getting this in our guaranteed issue period, and we'll put male. and a non-smoker. And how about 64119? And then go down and select G right there. We talked about that being the Cadillac, and submit. And what it's doing, and the Missouri Department updates this on a weekly basis. So this is showing the companies that write the Plan G Medigaps in my zip code. And it shows you the annual premium over there. The first one was $36.50.29. Now, if Sonia clicks on annual rate, the heading annual rate, it's going to sort this list in the lowest cost up to the highest cost. So if she clicks again, she can just click again, or she can scroll down like she's doing. You'll be able to see what the rates are. So you see some $5,000 ones out there. And you say, what is going on? Why are these prices so different? Every company kind of does their own thing. And so they're able to charge whatever rate they think they need to charge to make their margin. But as a consumer, the benefits that you get from these companies on a G plan is standardized. So I talk about this like buying a gallon of milk. I can go buy a gallon of Erickson milk for 2% milk at Hy-Vee for $5, or I can go to Quick Trip and I can buy it for $8. It's the same gallon of milk. It's the same benefits on these plans, but yet the price is different to the consumer based upon name recognition, based upon kind of whatever underwriting they think they need for that. And so it pays to shop is kind of the moral of that story. So again, and you've got contact phone numbers over there at the right, so you can call and ask them about the benefits and about what it takes to sign up with them. But definitely price shop for Medigap. Very important. Okay, and let's can you just go back to where we got into the rate shoppers guide before, like arrow back one? Yeah, actually a couple to get back to that main menu. Thank you. So the Missouri Medigap shopping guide is a great tool. It will explain all the plans out there. The shopping guide will. And the consumer complaint index, you can run that. And what that is, again, that shows how many complaints have been levied against the Medigap insurers. I think it's as of 2 years ago, but you can kind of get a feel if it's over 100. 100 is about the standard. So if it's over 100, they're getting more complaints per policy than the standard. So, anything over 100 on the index is something to kind of keep in mind, that the customer service and policy owner service might be not what you want. So a great tool. Again, you'll have access to that via the PowerPoint. So if you're in the market, definitely look through these items on the Department of Insurance's page. All right, so let's go back to the presentation. So let's do now a comparison. So we've got Clara with the same scenario. She had a 4-night hospital stay for a heart attack. It was $500,000. And we talked about original Medicare. Her out-of-pocket was $101,826. So on original Medicare, with a Plan G Medigap, which we talked about, that's designed to pick up those out-of-pocket. The hospitalization, I'm trying to move my thing out of the way here. The hospitalization, a $1,600 deductible would be covered by the Medigap. The Part B, annual deductible of $226. By law, that can't be picked up by the Medigap insurer, so you're responsible for that, unless you have an F plan that's no longer sold. And then the coinsurance, of over $100,000 is picked up by the Medigap insurer. So when you look at the bottom line there, you've got the $226 Part B deductible, annual deductible. You've paid in Medigap premiums of about, again, it would depend on what insurer you pick. I picked $170 a month for 12 months. It's a little over $2,000. So your out of pocket would have been $2,266 if you had a Medigap policy, compared to if you didn't, $101,000. So clearly, we know which one saves the day here. The Medigap saved you a ton of money on this scenario. So your choices, you've got original Medicare that we talked about, A and B, with an optional Medigap or Medicare supplement policy and an optional prescription drug policy. Or the other side of the defense, you've got a Medicare Advantage, which really combines Part A and B with the drug plans typically. And it's sold and administered by private insurers. So on the left-hand side, it's administered by the government. You don't have any pre-authorization required. There's really no networks as long as they take Medicare, that sort of thing. On the Medicare Advantage, you do have a network to stay within, and there can be prior approval limitations as well as geographic limitations. So we'll talk about those. So yeah, don't confuse a Medicare Advantage plan with a Medicare supplement plan. They are totally different things. Only original Medicare can have a Medicare supplement or a Medigap. So a Medicare Advantage plan cannot have a Medigap. So again, private insurers versus the government administering your policies. And it's going to cover the benefits and services under Part A and B, just like original would. They can have a premium, but the vast majority, I shouldn't say the vast majority, but many of the Medicare Advantage plans now don't have an additional premium associated with them. You still pay your Part B premium of that $164, but you don't have an additional premium associated with it. The plan can kind of determine how they charge for their services. So for instance, with original Medicare, we saw when you were admitted, it was a $1,600 deductible. Well, with a Medicare Advantage, they don't have that, but they may have a copay of $300 or $400 a day for your stay. So they manage your benefits and expenses a little differently, and every plan is different. So I can't give you a standard. It's always $325 a day or $400 a day in the hospital. It varies from plan to plan, which is why you have to look at the fine print. Almost every plan has a network that you stay within. So if you're used to doing that, and that's not a big deal, that's an okay thing. But the thing that I tell people, sometimes when we counsel people, they went to Medicare Advantage because they wanted a free Silver Sneakers membership. And what we tell them is, and then they found out they couldn't go to their doctor that they wanted, but they got the free Silver Sneakers. And we say, first thing you need to do, make sure you can go to the doctors and hospitals that you want to go to. I mean, that's number one, right, with your healthcare. So see if the providers are in network. These plans usually provide prescription drug coverage. Many of them have basic dental, vision, and hearing. Again, the devil's in the details. Make sure that what you're looking for is within the plan, because some plans are very generous. For instance, I know there was a plan this last year that had a $2,000 dental benefit that you could use for basically anything from first dollar. Then there's others that say we just cover x-rays and cleanings. So if you needed a crown or a filling, that wasn't covered. So again, you kind of got to do a little legwork on this and make sure you stay within network with Medicare Advantage. So Benefits and limitations. Comprehensive coverage is certainly one. When I say that, we talked about the dental, vision, hearing. They also have, many of them have an over-the-counter allowance that they'll give you. It might be $100 a quarter that you can use for aspirins, Band-Aids, things like that, that you would get over the counter that wouldn't be covered by original Medicare. So that's very nice. The prescription drug coverage is usually included with the Medicare Advantage plan, so it's not a separate drug policy with a separate premium. So that's definitely a benefit. The cost savings is great with a Medicare Advantage plan as well. And I think the big thing too with a Medicare Advantage is they've got a maximum out of pocket. And that's the thing to remember is, again, with that safety net we talked about, with traditional Medicare, you needed a Medigap policy to get that safety net. With the Medicare Advantage plan, they are required by law to have a maximum out of pocket. So any 1 year out of your pocket, you won't pay over X dollars. And X, at least this year, was anywhere from, I think, about $3,400 was probably the lowest, up to $10,000 based upon the plan that you chose. So that's still a great benefit to be able to have a cap on the expenses that you're responsible for. So the limitations, we talked about network. You know, is your provider in network? If you travel out of state, we find somebody in network. So there are restrictions. There can be pre-authorization for providers, for a specialist, things like that. Again, we talked about the geographic restrictions associated with an Advantage plan. But Advantage plans are convenient because everything's bundled into one kind of nice little package with a bow on it that makes it kind of easy for you to kind of get your arms around and understand what you're going to be charged. So that's kind of the limitations. So kind of let's look at the next. So in order to have a Medicare Advantage, you have to be enrolled in Part A and B. And again, you have to pay the Part B premium. And again, we said Part A is typically premium free. So you need to be enrolled in that, live in the coverage area. And your annual election period is October 15th through December 7th, which we kind of talked about that. Open enrollment for Medicare Advantage is January through March. And that's for people that are already enrolled in a Medicare Advantage, and they can make one change during that time frame. So they could change to a different Medicare Advantage plan from what they already had during that time frame. Or if they said, I've had enough fun with Medicare Advantage and I want to go back to original Medicare, they can do that as well. So that's a very good benefit for them as well. So, and the change will be the next month after they made that switch. So you don't have to wait long to see the impact of that change. So trial periods. Medicare Advantage has a trial period. So if you're 65 or older and you enroll in Medicare Advantage for the first time, so let's say you've been on original Medicare and you said, I'm going to test the waters for Advantage. I like all those ads that are on television. They sound really good. I believe Joe Namath, everything that he says. So you sign up. You get halfway through and you say, wow, I kind of missed my original Medicare with my Medigap plan. And I wish I could go back. This trial period lets you go back with the same guaranteed issue rights during that first 12 months of that policy. So that's the good news, is they let you dip your toe in the water a little bit and return back to where you were at. You don't have to go through medical underwriting or anything like that, so long as that insurer is still selling that plan. So that's a good benefit for somebody that wants to try it, I guess, and decides that they want to go back to the original Medicare. So again, what I'd caution you about with a Medicare Advantage is network. Make sure that all your doctors, hospitals, labs are part of your plan's network, because otherwise you're going to be paying out of network charges, and that's no fun. In the same way, you're going to review your drug coverage and costs. Again, we said most of the time there's a drug plan that's bundled with your Medicare Advantage, but you need to see how well it pays as compared to a standalone drug plan. The third, just understanding your cost share. Typically, a Medicare Advantage works with copays and co-insurance payments, less on the deductible side, but more on the copays. So understand what you pay for the services and kind of how the private insurer gets their money. Is something to make sure you understand, and really make sure you understand what the maximum out of pocket is. Again, I've seen from about $3,400 to $10,000 on the maximum out of pocket. So that's your safety net, what you're comfortable incurring if you have a big hospital bill that you're going to have a big out of pocket expense. And clarify the specifics around the extra benefits, like those vision and hearing and dental that I talked about. Make sure that it provides you one pair of glasses a year or something like that versus, more comprehensive benefits. Okay, so now let's go back to Clara. And let's say that Clara had a Medicare Advantage plan with a $5,000 maximum out of pocket clause, and it didn't have an additional monthly premium. So as we said, there's quite a few of those out there. 5,000 is about the average for the max out of pocket. So her plan may have been, and again, plans vary, but for our purposes of our example, the Medicare Advantage plan had a daily charge for hospital stays for days 1 through 5, and she stayed 4, of $325 a night, or $1,300. So that's going to be out of Claire's pocket. And there's going to be additional copays as well. So the doctors will have copays, the surgeons will have copays, the labs may have a copay. Again, some plans different. Some don't have a lab cost if you stay within network. So it's hard to quantify here on this, but the bottom line is the patient is not going to be out of pocket over $5,000 with a Medicare Advantage plan. And they didn't have to pay additional premiums to get that kind of coverage. So that's a pretty good deal. So compare that against the original with a G Medigap plan, which we already talked about. Their out of pocket's going to be about $2,040. So, this, as you look at this, it would be great to have a crystal ball to be able to say, how many years am I going to be in the hospital in a calendar year? If I knew that, it would be easy to figure out if a Medicare Advantage plan would be cheaper, or original Medicare with a Medigap might be cheaper. But again, you just have to look and see what you're comfortable with, because your coverage varies and what you pay varies based upon what you choose here. So yourself what you're comfortable with your maximum out of pocket. Some people like the feeling of, if I pay my monthly Medigap premium of $170 a month, I know I'm not going to have any surprises. And they like that. And they're willing to say, even those years that I didn't have a hospital stay, I'm okay. It's kind of like car insurance. You have car insurance, and there's a lot of years that you don't have a wreck and a claim, but you still pay it. So that's kind of the way this original Medicare with Medigap works as compared to the Medicare Advantage plans. So what goes into the decisions? Finances. Can I afford the monthly premiums for Medigap, even when I'm 80 years old and they've gone up to maybe $300 a month? And how important is having some help with dental and vision coverage? That factors in. Choice, I want to go to whoever I want to go to that accepts Medicare. So I want a broader network. If I want to go to Mayo, I want to go to Mayo. Or conversely, I'm okay with my network. The networks have gotten better with Medicare Advantage plans. Many of them have nationwide networks as well. So it has gotten better. But some providers don't accept certain Medicare Advantage plans. And so you just need to, again, know if your provider accepts that plan. And then just the fluctuations for your budget. If you want to avoid any month that has a several $1,000 medical expense and you'd rather just pay the premiums, pay as you go, then you've got that choice either way you look at it. So that's kind of what goes into the decisions. So let's test your knowledge a little bit. So we've got Nancy here, and Nancy's turning 65 in a couple of months. She's completed an aggressive cancer treatment a couple of years ago. She's financially stable. She travels frequently. She likes to go on vacation, both to Europe as well as the States. And, she's got a close tie to her cancer doctors. So choice of doctors is very important to her. So what do you think Nancy would choose as far as a Medicare option? Would she choose original Medicare with no Medigap? Would she choose original Medicare with a Medigap? Or would she choose a Medicare Advantage? So I'm trying to figure out the best way to do this. With Nancy, her choice is probably going to be original Medicare with a Medigap plan, just because she wants to keep her doctors. She wants to make sure that she can go to them. She can go to a specialist when she wants to. If she travels out of state, she's still going to be in network as long as the provider accepts Medicare. And she already had a kind of pre-existing condition that may reoccur since it was an aggressive cancer. So she wants to have kind of the best health care that she can get. And so she would probably pick original Medicare with a Medigap. Okay, let's go to another one here. So Ron is in good health. He's still working, even though he turned 65. He plans on staying on the company group insurance for a couple more years. So he deferred enrolling in Medicare Part B because he's already getting the insurance from his company. So he doesn't really want to pay that $164.50 to Medicare yet because he's already getting that coverage. It would be duplicate coverage. He doesn't really have a regular doctor. He's in, like I say, he's in good health. He goes to a doctor if he feels something wrong, but he really doesn't go much. And he doesn't travel out of state much. So as we're thinking about him, seems like he would be, once he got on Part B, of course, and off his company plan, he would be a good choice for Medicare Advantage. Because the Medicare Advantage, he could probably find a doctor that he liked within the network. He didn't have to worry about out-of-state travel and out-of-network. It didn't have any serious health concerns right now, not on a lot of prescription drugs. And so he's in good shape. So he would probably be a Medicare Advantage guy. But there we go. Okay, so this gentleman, he's also in good health. He's out there hiking in Colorado. He likes to go out there a couple of weeks a year. He's on a fixed income budget. He needs, right now, he needs a few crowns. So he needs, quite a bit of dental work. So he might be a good candidate for a Medicare Advantage plan because the Advantage plan includes dental benefits. He'd want to make sure what those benefits were and if his dentist was in network or not, or if he could live with one of the dentists that are in network. You know, the travel to Colorado a couple of weeks a year, if you had an emergency, the Medicare Advantage program has to pay for that services with the emergency. So that would probably be okay. And the fixed income fits him fine because he gets a lot of extra benefits like his vision, hearing, and dental. So yeah, Medicare Advantage is probably a good choice for him. Okay. So once you chose Medicare Advantage, or if you choose it, there's actually probably 40 plus Advantage plans to enroll in. So how do you know which one's best? So we're gonna see that now. So we're gonna go quickly to Medicare Gov because I know we're running out of time. Okay, and we're gonna go down and we're gonna say find health and drug plans. And we're gonna enter our zip code 64119. And we're gonna look at Medicare Advantage plans, the first one there. And it's saying, do you get help with costs from these programs? That'll be our next series about the help, but we're gonna say, I don't get any help right now. And yes, we wanna see our drug costs. Okay, and let's just add a couple of drugs. Let's just add simvastatin, SIMV, and it'll populate it. Or you can pick any of those drugs, actually, it doesn't really matter. And just add to my drug list. Yep. And add another drug and just type LEV and probably should get something out of that. Pick any of those and add and say add to my drug list, and then go down and say done at the bottom, Sonia. So this is personalized for you. And then we're going to choose our pharmacies. So we're going to go down, just scroll down a little bit there, click mail order, CVS, and Walmart. So it's got all the pharmacies within your range there that we had at 5 miles. And you can see at the bottom, and then you just click done. Yep. And now what it's doing is it's looking at all those 40 plans out there, and it's trying to say which one's going to be the best for you, the Medicare Advantage. You can see the plan benefits over to the right. It's got vision, dental, hearing, fitness, you know, those things. It tells you what the copays are. Nothing for a primary doctor. Specialist is 40. There isn't a monthly premium over at the left for the Advantage plan. You still have the $164.90, but you have that with the original Medicare as well. No drug premium, so that's good. No deductibles there for health or drug, and it's got a $4,900 in-network maximum out of pocket. So that's kind of what that is. So let's click add to compare there, Sonia, right there. And we can go down. These are HMOs. As you keep scrolling, and we'll just show that there'll also be some PPOs that come up. Like there's a PPO right there. Again, it's got a different in and out of network as well as in-network plan. So we could compare those, and you can drill down into the benefits. So that's how you would compare the Medicare Advantage programs. That gives you kind of the side-by-side right there. So what I wanted to, this isn't a training session today, but I wanted to put you in touch with some good resources as you make choices for your Medicare that make this a lot easier to wade through what's available to you. So, all right, let's go back to our presentation, Sonia. And so with Medicare Gov, you create your own personal portal. So you'll create your account. It'll save all of your drugs out there so you don't have to enter those every time. And then you can filter what's important to you. Say, I want a PPO. I don't want additional premiums, or you can do it by, if a carrier, you like United Healthcare, you can just sort it by United Healthcare plans, or Blue Cross Blue Shield plans. And that bottom one, schedule a meeting with the claim counselor. This is what we do every day. And so we'd be happy to be able to go through this with you, but we also want to give you the power to know where to get these resources. So a couple of things. Again, we talked about general enrollment period is January through March for the Advantage plans. October 15th through the 7th is really when you can change or enroll in an Advantage plan as well, or change your Part D plan, which again, every year you need to look at your Part D plan, your drug plan, to see if it still is the best plan for you. And Plan Finder will help you do that as well, like we just looked at. Okay. And lastly, I would just say this is a very rewarding opportunity for you to join our team. They provide great instruction for how to become a counselor, how to learn about Medicare, how to help people. So if you're in retirement, nearing retirement, just want to help people, we have people of all ages that are counselors that do one-on-one counseling and help people wade through their Medicare choices, kind of like we did today with some of our scenarios. So with that, I think we're at the question mark, but I think we're about 2 minutes according to my clock. Angelina, you kind of tell us what you got.
So we do have a couple of questions in the chat. We have one asking if they are looking specifically for specifically for a Medicare savings plan. Is there somebody in particular that they should contact, or should they just call the main claim number and then they'll direct them to somebody from there?
Yeah, good question. And maybe everybody else can put their thing on mute. That would be great, because we're getting some feedback. But on the Medicare savings, that'll be our next series, actually, part of our next series. But yes, call the claim contact center, and any counselor can help with the Medicare savings program for you. Good question.
We also have another one that asks about the differences between Medicare and Medigap when you're moving from states. Do you have to change your plans with the geographical limitations and the difference of providers?
Another good question. You can actually take your Medigap with you. So if you move to Texas, that Medigap that you bought in Missouri, since it's nationwide coverage, goes with you. So you don't have to change that at all. Now, if you go to do the price shop afterwards, you want to change plans, then you're going to be in a different bucket. So if you're in Texas, a resident of Texas, then that'll change to Texas. But no, you can take your plan with you.
Then we have another one looking through the Advantage plan finder that you pulled up. Is there also a way to find if a certain provider is in a network in one of those plans?
Yes. When you pull up any one of those plans, like say that you selected a Blue Cross plan, they all have a network provider link on the detail for their plan on Plan Finder, and you click on that. I'll be honest, it's not the greatest. A lot of times it just links you to, say, Blue Cross's website, and then you have to hunt for the provider. Some of them are better than others, but a lot of times it just kind of directs you to their website, and that's when you look for that particular plan and the network providers within it. So sometimes you have to dig a little bit, but it will get you there.
Okay, I am going to go ahead and launch the closing poll as we're going here, but we do have 2 more questions if people are able to stay on for those. This one says, when you showed us the example of the total doctor and hospital bill of 500,000, that is the total amount billed. Is that also what they use as the allowable amount?
No, I mean, my assumption for the example was that was what Medicare allowed. And so that's why that percentage would be paid. So no, if they billed, $200,000 for a procedure and Medicare said we only reimburse for 100,000, then it would have been 100,000. So for purposes of example, that would have been what was allowed by Medicare. That was the expense.
And then the last one that we have in the chat here is, can you get Medigap years later, or is it only when you first enroll in Medicare?
Yeah, good question. You can get it years later. The only difference is you will have to go through medical underwriting, and you may pay more per month for the premium, or they may deny you based upon your medical condition. So you can get it anytime, any age. The amount you pay will be different based upon that. So that's why it's better to get it within that 6-month guaranteed period from your Part B effective date.
All right, thank you. And I'm sorry that I can't get my camera to turn back on for some reason. But thank you again, Gary, for presenting for us today. And thank you, Sonia, for going through the slides for us. Just a reminder to everybody, the slides and the recording of this will be sent out. Our next benefit one will be on July 12th, and our next technology one will be in 2 weeks on the 28th. And thank you, everybody, for joining us today.